in this current second COVID wave that we're seeing, the virus has also gripped rural India. Now 50% of the caseload in India actually comes from the rural parts. The government has hence formulated a separate action plan to battle the virus in villages where there's a clear lack of essential and basic healthcare.
The disease of the rich and those who live in urban India? Not anymore. Over the last few weeks, COVID-19 has reached the interiors of the country. The penetration like never before. Deadly, causing utmost misery and exposing the dismal healthcare system. Rural India now has half of the country's caseload. The Union Health Ministry has issued a separate set of guidelines keeping in mind the surge. Here is what the centre expects rural districts to do. Increased rapid antigen tests is what the centre is advising. Nodal officers will be trained in using rapid antigen detection kits. Contact tracing should be done as per Integrated Disease Surveillance Programme's guidelines. Look now for cases with influenza-like illness is what the centre says. A home isolation kit shall be provided to all such cases, which should include required medicines like paracetamols, ivermectin, cough syrup and multivitamins. Semi-urban and rural areas may plan a minimum of 30 bedded COVID care centres.
With mild symptoms and those who have not been tested as positive, or even if they are tested as positive but still symptoms are mild, could be isolated at home with provision of COVID care kit and instructions for moving to a higher center if the symptoms deteriorate. With this type of arrangement, most of the people in rural areas with mild COVID can be taken care of at home with simple medication and can be moved. The few cases who develop complications can be moved to higher level for treatment.
The COVID care centres should have separate areas for suspected and confirmed cases with preferably separate entry and exit for each. Suspect and confirmed cases should not be allowed to mix under any circumstances.
The guidelines stress on three important aspects, which is testing, surveillance and infrastructure. In the testing, it is advised that the nodal officers are familiar with using rapid antigen kits and promote for faster detection. In terms of surveillance, the advisory suggests that India's ambitious Integrated Disease Surveillance Project, IDSP, its strengths are utilized in ensuring that people with different stages of the disease are identified very early on so that the treatment can begin. In terms of infrastructure, the focus is on setting up COVID care centers, especially for those who cannot be isolated at home, and to make sure that enough medical facilities are available. Most importantly, the focus is on to separate the infected from the uninfected.
Keeping in mind the spread of the wildfire that COVID-19 is to rural India now, the government has had to come up with a separate set of guidelines given the limitations that rural India has in terms of hospital preparedness and testing facilities. The realization that one size can't fit all is writ large when it comes to the new and separate guidelines issued for rural India. In New Delhi, Sneha Mordani for India Today.